Hi, this is case of the day, and today is case 122, identifying mucoid impaction in asthmatics. Relevant? So this 39-year-old with a 30 years history of bronchial asthma on inhalers and other treatment, an appropriate treatment, had an acute exacerbation and came for a CT. And you can see the CT. I've created a video going from the apex to the base, and while there seems to be a little overinflation, there was no air trapping. And at the most, there are some ill-defined centrilobular opacities, a little bit of bronchial thickening, but nothing very significant. And we would pretty much read this out in a couple of minutes, saying that there's just some inflammatory bronchiolitis. So there's nothing really very significant. But then, if you look closely and you trace this bronchiole of the lateral basal segment, you see that it is obstructed, right? So there's mucoid impaction. You can see the lumen here, and then the lumen's gone, and it's still impacted here. And of course, you can show it better if you want to do reconstructions, etc. But that doesn't make sense here. But once you start looking for these, you start finding it. So here's another one in the posterior segmental bronchial branch, and then it opens up here after this area of mucoid impaction, and then they're everywhere. And here's another one in the lateral basal segmental bronchiole, right lower lobe, and then again it opens up here. So all these areas that completely plug the bronchus, where the lumen is completely gone, are areas of mucoid impaction. And this patient had more than 3 segments showing distal mucoid impaction. And why am I mentioning this? I'll just come back to this. But more importantly, is it important to mention this? Should this be reported? Should we talk about mucoid impaction in the distal bronchioles? And now all this came about because this morning I came across this article which I was reading. Mucus plugs correlate with small airway remodeling. And when I downloaded it, I wasn't aware that this was based on autopsy specimens to evaluate the last 2 centimeters of the lungs where we are unable to see bronchioles in routine practice. So they did a whole bunch of things, including micro CT, etc. Elegant study. If you just want to read sometimes just brilliant, beautifully done studies, this is one of them. And they concluded that mucus plugs are a prominent and spatially heterogeneous feature, and they're associated with all kinds of issues. Then there's an editorial which was even more gaga about the article. And they said that these are relevant as the location of mucus treatment target. So chances are, we're just basically elucidating pathophysiology and asthma. But then the question I had was that if they are looking at the last 2 centimeters, then what about the visible airways? What is the literature on that? And the article started with the fact that, we know that we're supposed to be looking for mucus plugs in the visible airways, and I hadn't really come across anything. So then I started checking these references an hour ago. And it seems to have started with this paper in 2018, which had completely gone under the radar because it's in a journal called the Journal of Clinical Investigation. I think it's an important journal because it seems to be very highly regarded, but it's not something that we radiologists would be ever looking at. And they've actually done a radiology kind of study where they've identified mucus plugs, and they've given examples here. And then based on the bronchopulmonary segments, they have scored, saying that, each segment has one score. So if you have more than 3 segments, then it's 3 or 4. And then they showed a whole bunch of data, and they showed that the healthy people rarely have any mucus, and these are the asthmatics. And then high was 4 or more, and that was a significant number of asthmatics. And the higher the score, people moved into a higher asthma grade stage, whatever. We don't, as radiologists, we don't really look at asthma otherwise, unless it is to do with identifying patients with ABP. And I've done a post on that, but I've completely forgotten to give you I'll probably put up a link in the video on the top right for that. Then is this 2022 paper, which again looks at this SARP cohort. And here they looked at mucus plugs persisting in asthma, talking about mucus plug phenotypes and then changes in mucus plugs, etc. And again, it was all about, if you know that people have mucus plugs, you can chase or treat them with specific mucoactive drugs. And the editorial on this was again very positive, but said that CT as a tool to assess intraluminal mucus, we don't know if that should be done in routine practice. And that would mean that maybe it's not realistic for physicians to send patients for CT scans just to look for mucus plugs. Now, therefore, clearly this is all a research thing. So, would they have relevance clinically? And as I said, I don't think currently we're going to get patients being sent for this. But then this paper published, I mean, it's supposed to be November 25, but it's one of those, I think it went online in August. And they say that if you have lower lobe dominant mucus plugs, these people have lower FEV1, increased exacerbations, and clearly this is relevant. So I don't know. I don't think that patients are going to be coming in to say, okay, look for mucus plugs in asthma. But asthmatics do come for CT scans for a variety of reasons. And one of them is, of course, ABPA related, but the other is just to look for other complications. And I think it takes just a minute to identify areas of mucus plug when you're scrolling on your workstation. And there's no harm mentioning very quickly that there is mucoid impaction, that there are more than 3 or 4 segments involved or less, and then leaving it at that, and then let the chest physician decide what to make of that information. So we've been doing that for some time without realizing this, because we've been identifying mucus plugs, but I've never looked at any of this data, so I wasn't aware. But I think it's worth the effort. So again, if you know that the patient has asthma and you're looking at a CT of the patient, take a minute to look for mucus plugs and say yes, no, and if yes, maybe more than 4, less than 4. There is similar research in COPD. I came across that while I was looking for references, but that's even more muddy, so we will address that another time if and as and when there is more data or a new paper or something like that. My WhatsApp channel, thank you so much for viewing this.